Good morning. Bonjour, mes collègues. It really is a pleasure to be a part of the CDRIN family and to share a few of the highlights of the Maritimes CDRIN Depression Hub with you. Joanne, Rudolph, and I, David, will share some of the activities that our hub is participating in. Next slide, please. Our Hub Executive Board is comprised of 8 members. We have 3 individuals representing lived experience, and one of those representing a family perspective, which sometimes is overlooked when thinking of lived experience. We have investigators reflecting the disciplines of psychiatry, psychology, and neuroscience. And we're also pleased to have the involvement of a board member representing an Indigenous perspective with a research focus on the mental health and well-being of Indigenous peoples. Also on our board is an administrator of healthcare services to help us translate our research efforts into meaningful impacts on service delivery. And lastly, we've recruited a hub research coordinator who brings not only the required academic credentials, but her own lived experience. So like all networks, our people are our best resource, so we're well positioned to further our mandate. With respect to our hub priorities, we've established a registry that really is the foundation of all of our patient-centered research activities. Those with lived experience and family members are integrally involved in all of the hub activities that we have pursued to date and will continue to do. And we have a focus on the development and use of research assessment tools that are being transported into the clinical context of service delivery. We also bring a focus on the building of capacity of research know-how and expertise among not only our trainees, but among those individuals with lived experience. And all of these efforts we expect to tangibly and meaningfully improve clinical service delivery. We've also already built upon the investment that CDRIN has provided by attracting additional resources, which will further our mandate. So to speak to our lived experience perspective.
Ooh, look, I can press the button. First of all, forgive me, I am so nervous, and for a person with anxiety issues, that is quite a challenge. So as a member of the Executive Board, I'm speaking on behalf of my colleagues with the lived experience. And we are trying to develop ways to make lived experience an integral part of the Maritime Hub and its activities. And to achieve this goal, we've already formed a Maritime Council involving as wide a spectrum as possible of people with both lived experience and family members from all areas of the region. Most of the members have already undergone the research training, and our hope is to encourage the participation of the Council in both research projects and clinical practices. And our idea is that the role of the Council will be continually evolving in response to the hub activities, and that the members will be able to participate to the extent that they individually feel comfortable and in a safe but really proactive environment. And that's it. I'd like to press the next button.
Well, my name is Rudolph. I'll give you a quick overview of some of the projects. The hub is really in its first few months of activity, and we're starting to do research that matters to people living with depression. And I'll give you a brief overview of 3 of these projects. The first one, as David mentioned, is a registry. And this is based on the idea that research is participatory and that the same information can serve both clinical and research purposes. So we view the registry as a participatory membership. The patients who are entering the registry are members and have their say in what we do with the data. And we believe that unlike the traditional research where researcher collects information and the clinician who referred for research never hears back about it, we feel that the same information that we're collecting should also improve the clinical care of the registry members. So you see on the right-hand side, there's service improvement reports to members, reports to clinicians, and links to resources available in the community. And that's the real-time function of how the registry will improve clinical care based on measurement and high-quality diagnosis. But at the same time, this will be a core for recruiting for clinical trials so that the new treatments can be introduced faster. And at the core of the registry is validity of our diagnostic and measurement instruments. You may have heard that the diagnosis of depression itself has come under fire recently. It's been criticized when in the field trials of the American Psychiatric Association, the reliability of two clinicians agreeing on whether a person has depression or not was unacceptably low, about 28 out of 100. And so we started using the structured clinical interview to diagnose depression, and so far we have interviewed 22 members twice, and in 19 of these cases we were able to agree on the presence or absence of depression. So that's a high reliability, and it's a good demonstration that diagnoses really mean something and we can base treatment on them. And finally, we are initiating some multi-hubs efforts. So one of the questions that people really care about is who benefits from psychological treatments such as cognitive behavioral therapy, and who benefits from medication? Can we tell in advance rather than trial and errors extending suffering? So we're focusing on this question, what works for whom, in terms of whether a person with depression is more likely to benefit from cognitive behavioral therapy or from antidepressants. And to do it properly, we need actually a fairly large number of people randomly allocated between the treatments, over 600. And this is a good example of an effort that none of our individual groups would be able to do on their own. And we really need the network, like CDRIN, to do this. And at present, there are 8 centers participating in this effort that's going to the Canadian Institutes of Health Research next week. And all 6 of the current CDRIN hubs are very actively involved in that. And this is something that wouldn't be possible otherwise, and something that really will make a difference in the outcomes of people with depression. If this is successful, it may shorten the return to work and functioning by a number of weeks. So thank you very much from the Maritimes.